Hello and welcome to the private room exclusively for readers of the book, A Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmunity. And as opposed to me interviewing somebody today, it's just going to be me. What we're going to talk about is how, as you go through the health questionnaire before even walking in the room with the patient for the first time and first visit, how you basically know what happened and how they got to where they are that at the time they see you, simply by looking at some of the health questionnaire items and what each thing means and why it's so important. Because basically you can set up this timeline from well, even before they're born, but basically from like when they're born all the way up to when they see you, whether it's a child, a teenager, an adult, and why they end up with what they have. And kind of for fun here, we're going to do it where you may not even know the diagnosis that they're coming in to see you for any of their major complaints. You're just looking at their health questionnaire history, and you know why they're in there to see you. So let's go through this. So the first thing we're going to talk about is the birth history questions. So ideally, you're going to look for somebody term delivery, vaginal delivery, or term baby vaginal delivery breastfed, and for how long. So if you see that they're a preemie, you know there's going to be some issues going on, including there's some body parts that like to be more fully formed by the time delivery occurs, such as lung and those kind of things. So you're thinking, some body parts may not be ready to come out and get working like they really should have. Also, if you see a C-section delivery, you're thinking right away, well, the microbiome of that person you're seeing right from the get-go was actually the microbiome, the bugs that seed the gut at birth during a C-section. They're the bugs that are on the light fixtures in the delivery room and the skin of the nurses in the delivery room, which is definitely not the optimal microbiome to start with. And ideally, if you start with a healthy gut, you're going to start with a healthy immune system, establish that early on. And then if you see they're not breastfed, you go, well, that kind of is crummy, because breastfeeding can pretty much reverse the negative impact on the initial microbiome with the C-section delivery simply by breastfeeding. But if they're not breastfed, they didn't have a chance to turn that around. And then you also may see the box checked difficulty tolerating formula. And what they're basically saying is difficulty tolerating cow's milk dairy formulas. So right away, you know, there's a disruption in the gut that created a food intolerance right from the get-go. And then if they've already developed a cow's milk dairy intolerance, by the time you see them, they probably had plenty of time to develop other ones. And you may also see in part of the history a question about jaundice, and people may check that and go as a kid, and then you go back and go, oh, okay, that's part of the birth history. So the liver got dinged. Now the liver's not fully formed until about 8 months after delivery. So the liver getting dinged before it's fully formed, fully healthy and working, you go, okay, this person probably is going to have a hard time detoxifying. And we're going to be thinking that's probably one of the reasons why the accumulation of toxins, why they got these chronic health issues, including that's such a huge driver of autoimmune disease. But also the liver's got to make an absolute ton of important proteins to keep the body healthy, whether it's proteins for itself and the rest of the body, such as the amino acid glutathione, or if it's proteins that the brain will need to benefit from exercise, all those kind of things. And then when you look at the childhood history, you start seeing things like asthma, allergies, and eczema. You go, oh, okay, that's an immune system dysregulation. Oh, recurrent infections, recurrent ear infections, strep throat, sinus infections. You go, okay, they already have a disrupted immune system. They've lost that set point in the middle, and they've already gone up and down, allergies, asthma, eczema, recurrent infections. And say, okay, right from the get-go, or pretty early on in their life, they already have a disrupted gut and disrupted immune system. And then you figure out, well, you probably got a lot of antibiotics with these infections. So the antibiotics have disrupted the gut as well. And what you tend to see a lot of times in young people, they get in this vicious cycle where they get an infection, they have to take an antibiotic, but then that disrupts the gut, which then throws off the immune system. So they get another infection, which requires an antibiotic that throws off the gut, that throws off the immune system. So they have to get another infection to get another antibiotic that throws off the gut. This vicious cycle, boom, 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 boom. And ideally, the body is so smart and so good at healing that by the time, but the body wants to work its way out of this vicious cycle, but by the time they work their way out of this vicious cycle, they got to totally disrupt the gut, totally disrupt the immune system. They're already well along towards chronic health issues, including autoimmune disease as time goes on. Now, you also may see age at first antibiotic. And sometimes people know when they were just a child or teenager, the parent remembers. And so anything before the first year of life is terrible. Anything before the first year of life, even one dose of an antibiotic will disrupt the gut enough that it never rights itself until you help them write it. Now, 0 to 3 months, so not even a whole course, just one dose. So here, the worst is 0 to 3 months. That's the worst, but also you'll see people that have antibiotic at birth for issues related to the parent or issues related to some kind of infection right away. 3 to 6 months is the next worst. 6 to 12 months is the next worst. Anytime in there, and the earlier the worse, one dose disrupt the microbiome, you're going to see the results of that as time goes on. Also, you'll see a lot of recurrent use of antibiotics. And then there's also a box to check for acne. And if they check the acne box, what you're going to want to find out is, was it mild acne as a teen, which could be a million different things. But once it's moderate to severe acne as a teen, you know for sure that person has developed a sensitivity to proteins in wheat, 62 different kinds, one's gluten, and most likely a sensitivity to cow's milk dairy proteins, not universal, always the wheat proteins, but pretty much usually the cow's milk dairy. So then you know, just because of the moderate severe acne in this person, they've already disrupted their gut. They're already developing food sensitivity tests. Even if they don't have any gut symptoms, even if they're not showing any, the allergies, asthma, eczema, recurrent infections kind of thing, they may say, oh, I've just had one infection or 2 infections. But now you know already, because of that moderate severe acne, something's disrupted the gut, something's gotten it leaky, intestinal permeability disorder, and then they got these food sensitivities. So if somebody checks constipation and abdominal pain as part of this health questionnaire as a childhood history, they got a messed up gut because they have symptoms, but they can have no gut symptoms, but it's showing up maybe as moderate severe acne for the first time. And then we have the adverse childhood events. So the adverse childhood events, of course, create cortisol disruption, throws off the epigenetics, that then throws off, the body's ability to prevent all kinds of chronic infections, not chronic health issues, not just as a child, but as an adult too. Really gets that ball rolling the wrong way. And then you got dental history. So if you see somebody with gingivitis, you're thinking, oh, they got a disrupted oral microbiome. I know they got a disrupted gut microbiome then as well. And then you can tell your patients, that disrupted oral microbiome is just part of this whole tube being thrown off, nose, mouth, all the way down to the behind. If you got a disrupted microbiome here, giving you gum disease, gingivitis, it's disrupted down below, including you want to fix the disrupted microbiome in the entire tube, because you don't want that disrupted microbiome in your mouth, because that is going to drive increased risk of cardiovascular disease, gingivitis, cardiovascular disease, right? And then I'm just going to touch a little bit on the menstrual history, and we're going to go through even more of this stuff, what every symptom means in the entire, basically the whole questionnaire in the advanced scientific course. But I really want you to get a good foundation in this and why you're seeing this stuff. So here's the menstrual history. So let's say a woman will check bad flows, bad cramps. Okay, and you go, okay, there's hormone imbalance, but there's estrogen dominance. You go, estrogen dominance is a huge driver of that disruption of the immune system, where you go up and down at the same time. And you start thinking, hey, this disrupted the estrogen dominance premenopausally, huge driver of autoimmune disease. One of the reasons why 80% of people with autoimmune disease are women, but also a huge driver of cancer. You're thinking women premenopausally with estrogen dominance have a 5.4 times greater chance of getting breast cancer before menopause, and a 10 times greater chance of getting malignant neoplasms their whole life. And you're saying, oh yeah, this disrupted immune system is not only driving a lot of menstrual stuff and other stuff, but you're thinking, we got to fix this person, really get them great, because we don't want them to get cancer, let alone new autoimmune diseases. Now, then you ask them though, so the bad flows, bad cramps, did that start pretty much right from the get-go, or did it take a while? Well, if it's right from the get-go, what I'm always thinking is something created enough stress in the body, disrupted microbiome, chronic infection in the gut, food sensitivity, maybe adverse childhood events that threw off their cortisol even before they started their menstrual cycle. And with cortisol loving to throw off other hormones, you're thinking, well, that cortisol is just waiting around, couldn't wait to throw off estrogen progesterone balance. And really, estrogen progesterone balance only becomes really important at menarche when they start the menstrual cycles. But that cortisol just couldn't wait. And right from the get go, they had bad flows, bad cramps. But also, you go look at when did you start menstruation, when menarche happened. So oftentimes you'll see the people that come to see you, they may have started age 11, age 10. I've seen it 7 and 8, right? And you go, wow, that's early, right? So why would it be early? Well, what I'm thinking is somebody prior to menarche was not very good at getting rid of toxins from the body. And they accumulate a lot of toxins in the system already. They may have had a messed up gut, so they couldn't absorb nutrients such as the B vitamins. You need to run your detox pathways, for example. They have a messed up liver that couldn't filter out the toxins. And even if they dump the toxins into the gut was leaky, disrupted. I'd already developed food sensitivities like cow's milk, dairy, other kind of things. And rather than going in the toilet like the toxins should, they're recycling right back into the system. And they started building up toxins. Now, you may also notice on the family history that maybe people have had dementia, Parkinson's, all these kind of things like, ooh, maybe genetically there's some issues with the people in this family being good detoxifiers, and that lack of good detoxification, getting rid of toxins efficiently and effectively build up and nail the brain. In older people, it can look like that kind of stuff. In younger people, the building up of the toxins can look like early onset of menarche, because a lot of these environmental toxins that get into kids, women specifically as we're using now, are the hormone disruptors, the estrogen disruptors that basically act like hormones, estrogens in the body, including like BPA, one of the in plastics, is an estrogen disruptor. It acts like estrogen in the body. So what the body is seeing is a whole bunch of estrogens. Well, they're not actually estrogens, but they're estrogen-like enough that the body goes, oh, we have all these estrogens in the body. It must be time to have our menstrual cycles start at age 8, 9, 10, 11. And so when I see that early onset of menarche, I'm thinking, oh, this person has had some stuff going on. They are just chock full of toxins at such a young age, including these environmental toxins, estrogen disruptors included. Thus, they started their menstrual cycles early. So you now already know they have to have a messed up gut. They got to be bad at detoxification, including they've accumulated toxins so much, including the estrogen disruptors. They started their cycle early, then they got the bad flows, bad cramps right away. Well, possibly the toxins that built up were part of the creating stress in the system to lock cortisol in the on position even before they started menarche. That's the bad flows, bad cramps came right away. And you kind of know where they're going from there. And so I hope this helps, so that as you go through this health questionnaire before you even see the patient, or before you know even why they're there, you can pretty much go, oh, I see what's going on. Here's early onset of food sensitivities, disrupted gut. Here's disrupted liver. They're not going to be detoxifying well. Here's I should say ADD, ADHD. The first thing I'm thinking about is either the gut, because the gut's the second brain. It's got to make a lot of things the brain needs to function, including focus, but also cortisol disruption will throw off the body in a way that shows up in kids as ADD, ADHD, hard to focus, because when a bear jumps out and wants to kill you, cortisol goes up and you focus beautifully because you start running and you're jumping over logs, stuck under a tree branch. But if the bear keeps chasing you, day after day, week after week, month after month, now it's not really a bear chasing people, but you're locked in this fight or flight mode. It feels to your body like there's a bear chasing you, trying to kill you 24/7, that fight or flight mode, life or death mode. Well, eventually you can't focus as well, right? And you trip over that log, you get caught by that branch because you can't focus as well as you should. Now, unfortunately, what we tend to do is we give things, basically amphetamines, to children like this, and hey, they start concentrating better. Well, what you're basically doing is recreating the same issue that drove the cortisol issue in the first place. So it's kind of like, well, here's this black bear chasing them 24/7. Well, now you're not focusing you're able to focus. You're so pooped out, your brain's just so tired. Well, now that you're not really all that focused on this black bear, what we're going to do is give you a grizzly bear. Oh, you will focus now. here's this amphetamine based on grizzly bear, and they focus better, but it doesn't last forever because the brain gets tired of running from the bear 24/7. So what you want to do is figure out, of course, what caused enough stress in the body to lock that cortisol in place at a young age. Was it the food sensitivities? Was it some vitamin deficiency? Whatever it was, maybe chronic infection in the gut, mold's a common one. And but all this stuff is going on even before you see kind of, well, so what are all their health issues? Whether they're a teenager or an adult or whatever, you start seeing those. You go, I know where they came from. I can see it because I can see from the history exactly how it started, how it progresses. There's, and then you're going to be able to know kind of why they got this, and then just kind of work backwards with your testing, you'll pinpoint. So what was it that threw them off when they were young? And that's going to be a great thing to know, so that you can reverse the process, get rid of the autoimmune disease they have, prevent new ones, but also you can see preventing cancer in the future and preventing all kinds of chronic health issues down the line. Thank you so much. And like the song says, and like the book says, got a revolution, got to revolution. Thank you so much.